Delirium and Dementia. Like, share and subscribe. Delirium. Delirium is an acute organic mental disorder characterized by impairment of consciousness, disorientation and disturbance in perception and restlessness. It is a serious disturbance in mental abilities that results in confused thinking and reduced awareness of environment. The start of delirium is usually rapid, within hours or a few days. Etiology. Dimer's mnemonic. Drugs includes analgesics, anticholinergic, sedatives, nicotine withdrawal, alcohol intoxication or withdrawal, street drug intoxication or withdrawal. Infection includes pneumonia, UTI, cellulitis or skin ulcers, abscess, meningitis or encephalitis. Metabolic includes electrolytes abnormalities, sodium, calcium, and magnesium, hyperthyroidism, hepatic encephalopathy, renal encephalopathy, B12 deficiency, hypoxemia or hypercarbia. Environmental includes unfamiliar environment, lack of visual or hearing aids. Retention includes constipation, urinary retention, and pain. Structural includes stroke acts or CHF seizure. Sign and symptoms. Reduced awareness of surroundings. Being withdrawn, with little or no activity or little response to surroundings. Poor thinking skills. Poor memory, such as forgetting recent events, not knowing where they are or who they are. Behavior and emotional changes. Types of delirium. Experts have identified 3 types. Hyperactive delirium. The person becomes overactive, agitated or restless. Hypoactive delirium. The person is underactive, sleepy and slow to respond. Mixed delirium. Symptoms involve both types of delirium. The person may quickly switch back and forth from being restless and sluggish. Alcohol withdrawal delirium. Diagnosis. Mental status assessment. Physical and neurological exams. A neurological exam, checking vision, balance, coordination and reflexes, can help determine if a stroke or another neurological disease is causing the delirium. Blood test. Urine examination. CT, MRI. Medical management. The first goal of treatment for delirium is to address any underlying causes or triggers. Treatment then focuses on creating the best environment for healing the body and calming the brain. A healthcare provider may prescribe antipsychotic drugs, in which include haloperidol, risperidone, olanzapine, quetiapine. Dementia. Dementia is a permanent and progressive loss in the ability to make new memories and general cognitive decline, ultimately resulting in death. Etiology. Significant loss of neurons and volume in brain regions devoted to memory and higher mental functioning, neurofibrillary angles, twisted nerve cell fibers that are the damaged remains of microtubules. Environmental factors. Infection, metals and toxins. Excessive amount of metal ions, such as zinc and copper, in brain, deficiencies of vitamin B6, B12 and folate. Possible risk factor due to increased levels of homocysteine. Degenerating disorders of CNS, Alzheimer's disease. This is the most common of all dementing illnesses, Pick's disease, Huntington's chorea, Parkinson's disease. Sign and symptoms. Personality changes, lack of interest in day-to-day activities, easy mental fatigability, self-centered, withdrawn, decreased self-care. Memory impairment. Recent memory is prominently affected. Cognitive impairment. Disorientation, poor judgment, difficulty in abstraction, decreased attention span. Types of dementia. Cortical dementia. Dementia where the brain damage primarily affects the brain's cortex, or outer layer. Cortical dementias tend to cause problems with memory, language, thinking, and social behavior. Subcortical dementia. Dementia that affects parts of the brain below the cortex. Subcortical dementia tends to cause changes in emotions and movement in addition to problems with memory. Progressive dementia. Dementia that gets worse over time, gradually interfering with more and more cognitive abilities. Primary dementia. Dementia such as Alzheimer's disease that does not result from any other disease. Secondary dementia. Dementia that occurs as a result of a physical disease or injury. Medical management. Treatment modalities. Tacrine hydrochloride, donepezil hydrochloride, memantine antipsychotic agents. Risperidone, quetiapine, and olanzapine. Antidepressant agents and mood stabilizers. Low doses of the selective serotonin reuptake inhibitors and other new or antidepressive agents should be considered. Improve sleep. Interpersonal relationship.
Difference between delirium and dementia.
Onset. Sudden, with a definite beginning point. Slow and gradual, with an uncertain beginning point. Duration. Days to weeks, although it may be longer. Usually permanent. Cause. Almost always another condition, e.g., infection, dehydration, use or withdrawal of certain drugs. Usually a chronic brain disorder. E.g., Alzheimer's disease, dementia with Lewy bodies, vascular dementia. Course. Usually reversible. Slowly progressive. Effect at night. Almost always worse. Often worse. Attention. Greatly impaired. Unimpaired until dementia has become severe. Level of consciousness. Variably impaired. Unimpaired until dementia has become severe. Orientation to time and place. Varies. Impaired. Use of language. Slow, often incoherent, and inappropriate. Sometimes difficulty finding the right word. Memory. Varies. Lost, especially for recent events. Need for medical attention. Immediate. Required but less urgently. Thanks for watching.